Hi, I'm Aparna Goel. I am a transplant hepatologist at Stanford University. Thank you for joining me today. I'm here to discuss the recent withdrawal of obeticholic acid from the market and some of the rationale behind that decision and how to move forward with managing your patients going forward. So as many of you have heard, that obeticholic acid has been withdrawn from the market as of just earlier this month. There's a little bit of background for why this has occurred that I will review with you. So as many of you remember, obeticholic acid received conditional approval back in 2016 based on the results of their pivotal trial, the POISE clinical trial, where the primary outcome was met, which was a reduction in alkaline phosphatase, which is widely accepted as a surrogate marker for good control of PBC. Unfortunately, there was a confirmatory trial that was attempted to be performed after that called the COBALT clinical trial, and that failed to demonstrate that obeticholic acid improved liver-related outcomes. So the confirmatory COBALT trial had several issues with it, mainly being difficulty to enroll patients and sort of functional unblinding of patients and high dropout rates. But because of the failure to show that there were improvements in harder clinical outcomes, the study sort of failed to demonstrate that obeticholic acid could potentially improve the long-term health of PBC patients. There's been several FDA warnings with the use of obeticholic acid ever since its approval. So over the years, there's been black box warnings. There's been restrictions to use in patients that do not have advanced liver disease, that do not have any findings of portal hypertension. So this is sort of the last in the series of the FDA warning. So back in December of 2024, the agency issued a drug safety communication noting that there were cases of drug-induced liver injury or serious liver injury among patients that were treated with obeticholic acid for their PBC that did not have cirrhosis. And it really was the, a sort of reevaluation of the risks of using obeticholic acid in our patients with PBC compared to the benefits that led to the request for a withdrawal. And eventually, just earlier this month, the medication was withdrawn. So it doesn't seem like there's any new safety concerns between the December letter and the September 2025 withdrawal from the market. It really was just based on an assessment of the risks that were initially found when the FDA issued that initial communication in December. So what this means for our patients is many patients that have been on obeticholic acid for quite some time, that have achieved biochemical remission, have achieved good biochemical endpoints, maybe normalization of their alkaline phosphatase, bilirubin levels, will be asked to stop their obeticholic acid within the next 60 days. There's a transition period of about 60 days. These are patients that you should try to see in the clinic during this period, or they'll likely be reaching out to you and need to discuss with them the appropriateness of using other second-line therapy options. We do know that obeticholic acid, when it is discontinued in our patients with PBC, most patients do tend to have a rebound and an increase in their alkaline phosphatase and bilirubin levels. So many of our patients on obeticholic acid will need to be transitioned to other second-line therapy options. And choosing which one is appropriate for them really depends on, other sort of symptoms they might be experiencing, other concomitant medications that they may be on, and really determining what the best option is for them. So once the transition period is over, which ends in November, there will be no more commercially available obeticholic acid in the U.S. I hope this answers some questions related to obeticholic acid's withdrawal from the market, and I hope you enjoyed listening to this podcast.